flu? Is it like the flu? I'd like to say, to start off with, it is not the flu. Even though it is a respiratory infection, there are there are similarities that could be seen on it, but the way that the symptoms are not all completely flu symptoms. So typically, what you see is fever, as well as cough and difficulty breathing. And typically individuals who have those have symptoms that are seen in as little as 2 days to up to about 14 days after they're exposed to the virus. Now, I should also preface, I am not a doctor, I am not a nurse. So if you have medical related questions, I'm not the right person to answer those. What I will be sharing later on is a phone number that you could call into, or you could share with any of your constituents if there are general questions and or concern with regards to symptoms that would be appropriate for you to call. But if you have a provider, that's a good place to start off with as well, calling in, and then they can triage to see what next steps need to be made. So what we're looking at, as opposed to some other respiratory outbreaks that we've been familiar with and seeing, so for example H1N1 back in 2009, the risk of this particular virus is affecting it's affecting folks that that we typically did not associate back then. And so we do know that older adults, so 60 years plus, are at a higher risk factor for severe illness, as well as individuals with chronic medical conditions, such as asthma or COPD or high blood pressure or heart disease. Individuals with weakened immune systems, so for example, if you have individuals that are going through chemotherapy, individuals also who are pregnant are at higher risk as well. One of the things is that children are at less risk for severe disease. So how does it spread? We do know that it's airborne. It exists in droplets. So with how, you can breathe them in, you can cough it in, you can get it transmitted through contact. So, you touch a surface and then you touch your face and your nose or your mouth. That's the way that the virus can spread. If you cough and you don't cover your mouth, or you sneeze and you don't cover, your mouth and nose area, that's how the droplets can spread. And that's why in a lot of the messaging that you may have been hearing for the last few weeks is that we really are looking at what we call respiratory hygiene, ways in which you can reduce the spread. And so when you do cough or when you do sneeze, making sure that you're covering it either with a Kleenex, or you're covering it with your arm, kind of doing the vampire maneuver. We also highly recommend washing your hands after you touch surfaces, or using, if that's not possible, an alcohol-based hand sanitizer. For the length of time for washing your hands, the recommendation is 20 seconds. So if you sing happy twice, you want to make sure that gives you kind of the time frame. And just some other things of cleaning frequently the surface area, countertops, computers, keyboards, making sure you stay home when you're sick. Try to avoid contact with people who are sick. Vulnerable groups, so those that are at high risk for severe illness that I just listed, making sure that you're avoiding large gatherings. And there was recent guidance that just came out this week from the governor a couple of days ago, and we look at these, and this is what's called community mitigation, right? This is the way that we know from a public health perspective that we can reduce the risk for for disease. And I think I will stop there for just a minute, Jeff, and see how you'd like to proceed. That was quite a bit of information, I know.
All right, thank you. So the best place, in case people don't know, the best place for people to get more information would be Public Health Seattle King County website?
Yes, our website. Put the website addition on the comments, or actually I just saw that I'll put in the comments. But then also our phone number, 206-477-3977. That's for the King County Novel Coronavirus Call Center.
Mariel, can you repeat that one more time so I can put that in the chat?
Oh, sure, thank you. 206-477-3977. And that's, if you believe that you were exposed to a confirmed case, symptom type of questions, then that's a really good number for you to reach out to. But I also, recommend, calling your healthcare provider, and they can also give you additional direction. So, if you have symptoms like a fever, cough, or difficulty breathing, please call your healthcare provider. Do not go to the emergency room, call your healthcare provider. Now, if you don't have a provider, please contact one of our public health clinics, and they can be able to assist you. If there's a medical emergency, obviously, please call 911. Now, with regards to our call center, the one thing is that, there are a lot of individuals that have concerns and fears. So our call volume may be high. So, we do thank you for your patience on it. I do know that they have been making tremendous efforts to keep the wait time low. So I think the average wait time this week has been about a minute. But just do know that there are other people that are also trying to reach out for information.
All right, thanks a lot, Mariel. I'd like to bring in the two other speakers who joined us, Rana Amini and Julia Shi. Could you introduce yourselves? Rana, maybe? How about Julia? Oh.
Can you hear me?
I can hear you, yes.
Thank you.
Is this Rana?
Oh, yes, this is Rana.
Yeah, could you briefly introduce yourself to the people online?
Oh, yes. Hello, everyone. I'm Rana Amini. I am the Quality Manager and Population Health Manager at ICHS. And also, I am a pathologist. I'm not practicing here at US, but my background is I am a pathologist, and I have been working in global health for many years. And I also work at the community level and try to improve health for our community here at King County.
Great, thank you. Julia, are you online?
Yes, here I am.
Excellent. Can you introduce yourself?
Hi everyone. I just started my video. Can you see me?
I can see you now, yes.
Okay, good. My name is Julia, and I'm the Director of Nursing at King County Healthcare Center. So the population that we are serving is mainly API population, predominantly speaking Chinese or Cantonese, and we have people from like Vietnamese and Korean, Japan. So, and our employees is also from a diverse cultural ethnicity background. So,
great
glad to be here.
Thank you. Thanks for joining us. I'd like to step back just a little bit and start again with Mariel, because we had talked about healthcare for marginalized communities. There's a term that people may not know. It's called health equity. So I wondered if you could kind of give us a brief definition of that, and then if others want to join in on health equity and how you work with that in your organization.
Okay, sure. So as we know that many of our communities, the way that our infrastructure in our society is laid out, it really lays out into inequities. And so the idea of health equity is really to ensure that community members, especially the marginalized members of our community, have access to different resources within our systems, right? So it's not just the idea of healthcare access, thinking of health from a kind of more holistic, larger scale, where it's the access to healthcare, making sure that they have transportation for access, making sure that they have insurance coverage, making sure that there are all of those other what we term social determinants that are in play to allow our communities to be able to participate within these systems. And the idea being that we cannot expect individuals or families to be healthy if the system is not supporting them, since we do not live in a vacuum, right? We are all impacted by things that are external to our center of control. And so for us as a department, and as it goes into the response that we are currently living through and is underway in response to COVID-19, we're looking at, the main tasks that we do is conducting disease surveillance and investigation, coordinate services for cases for individuals that are under isolation and quarantine. We're disseminating messages and materials both to service providers, and not just in the healthcare, but it could be like a homeless service provider or other type of wraparound services and agencies and organizations, and as well as public facing materials, but also engaging with communities who are the most impacted and making sure that they are not just advising us, not just that we're working with them, but that they're also advising us with regards to our strategies. And the idea of weaving equity into all of these, into these 4 different main areas in which comprise our focus in responding to the outbreak.
Great. Rana, can you chime in on that? How does your organization, how do you work on health equity at ICHS?
Health equity is one of the topics that actually is in the mission of ICHS. And because we work with marginalized people, which mostly they are immigrants, and as Mariel was saying, they all are facing many different barriers for accessing health. So what we are trying to do right now, especially in the time of COVID-19, is that to provide information for them in different languages and be open to their questions so that they know that they can reach out to answer their questions. And we also, each of us individually here, is trying to reach to our own community and provide reliable information to them. Because if the communities don't have access to the English materials that are being distributed by King County, which also King County has provided them in several languages, but still, at ICHS, for example, we are offering services to 19 different languages last year. And so I'm seeing that because my background is that I'm Iranian, and I'm seeing the fear in the Iranian community because they don't have access to the reliable information. And also there is another barrier that's right now we all are very concerned about, and it is that if, one of the things that's very important in the COVID-19 is that to stay at home or do the quarantine and not to go outside. So many of our patients, they work at 2-3 jobs and they are in the service line, which can be affected very easily by this. And then their level of income will drop, and or they are not able actually not to go to work. So these are the things that we all need to be mindful in this time. I think that all of the nonprofits that are trying to reduce the barriers for our communities here also need to be mindful of how the impact of this epidemic can be on different communities. And because of that, the equity becomes more important. So, because it is different as for a Microsoft employee to work from home, then, for example, it is not possible to ask the same thing from a MA or nurse.
Yeah.
But the MA and nurse have the same level of life, and they all have the family members and everything. So I think we, as a bigger community, we all need to be mindful of all of these different items that is going to be coming up in the next weeks.
Yeah, thank you, Rana. Julia, how about you? How do you weave health equity into your work?
Well, I'm in the same line with Rana, right, from the ICHS. Yeah, exactly. So I have to say that at King On right now, we have a lot of like frontline staff. They are seeking out the information from the official website, the CDC or King County Department of Health. They do express the concerning about like the language they use in those material, and also whether or not there's some translation being done are culturally sensitive, or so sometimes it's just like if the staff members or our residents, their families, if they can understand the English and also the Chinese, that would be fine. And sometimes they were like, it doesn't quite make sense when I read the Chinese version of it. So it was just an example. And the second thing, well, that was also like pretty much similar to cross all the access to the information. So where the reliable information come from, whether or not the translation is culturally sensitive, and also in terms of like do the implementation. Because right now, coping with the COVID-19, what our management team has been doing here is we use the CDC English one and translate that into different language. And then the different language, like we will hold different in-services using different language, using different material, and give it to the staff member or the residents or family members speak different languages. So a lot of things that we kind of like doing it internally just by the staff. So therefore I was like, I'm just thinking that if within our network, or if we have something, be able to generate all those resources together and to distribute it more systematically, it will help us to save quite a bit of time, I would have to say.
Okay.
And the other thing is about the mental health, the social aspect of the, like if we're talking about the health equality, as again, if you need like a 14 days self quarantine, you have to stay at home. And for our organization and our community, we are very like to social, like to communicate with friends, and like to visit families. So, I mean, luckily we're seeing that our, again, families, our residents are super cooperative with us in terms of all those like government requirements that we have been implementing. But on the other side, we can see that there's a lot of kind of like a mentally like concerning, or people are start thinking about, oh, how long should I be able to stay, or how long do I need to do this? How long it will gonna last? So there's a lot of questions being raised by different level of employee. So I just want to say that in terms of like the mental health issue, that we are constantly dealing with that day by day. We have all those meetings. So just a little.
Yeah. Janet, I'd like to bring you in here at this point. How does your work in policy arena, how do you handle, or how do you address health equity?
Well, we are quite concerned about health equity, and particularly when there are identified disparities such as language access that affect people's health. We have been doing a lot of work even before this outbreak on trying to eliminate barriers, particularly at state agencies, but also within the healthcare system, that prevent people from getting the care they need, understanding things like instructions for self-care. So now, of course, all of this is really coming to a head. And one of the things that is a new opportunity in a kind of odd way is that since the president just declared a national emergency, there's an opportunity for the state to seek some waivers for the Medicaid program, which is the program that is available to people who are low income, and which was expanded through the Affordable Care Act. Still, there are people who aren't signed up who are eligible, or maybe even who are not eligible, for example, based on immigration status. And we know that our state is preparing a request for one of these waivers related to the national emergency that can decrease some of these barriers. So, for example, one of the big problems is churn in the so eligible people who fall off coverage because they didn't return a piece of paper or document something that was requested. They're fully eligible, but they weren't able to. And there's a general recognition now that it's going to be even harder to do that because people might not be able to find or contact the person who has that information that the state is asking for. So that we're looking at things like not terminating people who are covered so that they can continuously receive coverage. And of course, if you're sick, it's even harder to comply with some of these requirements. So that's just an example, but I saw an article where our Medicaid director, Sue Birch, was talking about things like waiving some eligibility requirements, which would be really great because we know that some of the disparities and problems with health equity relate to the fact that there are people who do not qualify based on immigration status for this coverage. And we've been working to advocate for improvements in that to fill the gaps that are left by the Affordable Care Act to improve and to allow people to qualify in an affordable for an affordable program. And we're also, of course, addressing the language access issues that others have mentioned and trying to get good information out there. I wanted to share, I'll share in the chat, a link to a blog in Spanish that is really trying to get the information out to Spanish speakers about what's going on with COVID. It's through KUOW. And actually, I'll try and get the exact link, but it's called Blog in Vivo. So I wanted to just pass that along as a resource for anybody who's working with primarily Spanish speakers.
Great, thank you.
Jeff, this is Mariel.
Yeah.
I can just add in a little
Sure.
bit, and those really good points that were just brought up right now. And so when I introduced myself, I told the group that I'm the equity officer for our HMAC response. And HMAC stands for Health and Medical Area Command. And having an equity officer within this structure is something that is not practiced across the country. It is actually something that's very unique. And for those very reasons that were just excellently laid out, that's why there's this equity officer position. And because of the size of this response, we actually have an equity response team that I help facilitate. So task force, for lack of a better term. And what we are doing is we're looking at all of these intersecting situations and issues that come up, because again, health doesn't exist in a vacuum. So we're providing guidance to decision makers with regards to what do you do if someone's facing eviction, having COVID, or they work in a facility where there were individuals with COVID, right? If you're within the health system, right? Or you're a first responder. And looking at questions of, okay, this is really great if, there are allowances that are being made for individuals who are under Medicaid, but if you're undocumented, what does that mean and what can we do and what should we do as a system and at the local and state level to be able to provide access to care to individuals who would be undocumented. So a lot of what we do is the crafting of recommendations and guidance to then be given to the folks that are making decisions but are also operationalizing those decisions.
Great. Thank you. I wanted to get back to maybe ask Rana, and you've addressed this already a little bit, but what are some specific issues that are popping up with the communities that you work with, immigrants and refugees, especially with the coronavirus?
Thank you very much for your question. one of the things that we are seeing at the clinic is that there is a level of cautiousness for our nations to come to the clinic or go anywhere, even if they have symptoms. So, and I think that is because they don't have enough information about available resources. And some of them are really, we are seeing that if they have fever, and we all know that fever is not, having fever doesn't mean that you have coronavirus, but if they get fever, they get so frightened that sometimes they don't want to talk about it because they think that if they say that, then they are not able to work, which is very essential for their families. So I think lack of good and reliable information is the first and most important thing that we need to provide for everyone and during different available venues. The other thing is actually right now with closing of the schools, there's another barrier and challenge for many of them because it is related that how they can take care of their children during this time. And we can see that problem even between our staff. So this is the second barrier. And the third is actually having access to items such as sanitizer or alcohol or things that they can help them to reduce their risk of infection because they need to use public transport more than anyone else. So they need to be more aware of all the necessary precautions that they need to take. So I think these three has come up right now. And also with the decreasing or barring the travel to the certain countries, that was quite a very important issue with many of our staff, and also I'm saying the staff because 80% of the people that work at ICHS, they also are immigrants. So what we are saying is that that is also an issue. For example, there was a story of one person that has came back from China, and it was not here in King County, it was in California, but they didn't want to tell anyone else because all of them worked in the service industry. And that was a huge challenge for them. Thankfully, they didn't have coronavirus, but we are seeing this fear of how people will face them. So here we also have stories from our patients about that they're seeing some discrimination regarding when they look and see that they are Asians, so they see the discrimination. And that was something that we try to work a lot about that. So these four topics are the most important ones right now.
Thanks, Rana. I'd like to turn to Julia. I wonder if you'd be able to address some of that social stigma, the racism that has been going around, and any other topics that are relevant to COVID-19 in your work.
Yeah, sure. Well, the thing is, we haven't really, or at least I haven't really heard anything about any discriminations that are going on within our surroundings. And when we had a chance to discuss about this among our family, our residents or their family members and the employees, and actually none of them, well, I didn't really heard anything about them being discriminated when they go to any places. Well, they didn't. None of them have verbally expressed saying that they have been hurt or something and relating to this. However, they do mention one thing, which their friends had experience, for instance, wearing the mask on the street. So they're the ones that they're like, oh yeah, this COVID-19 thing is going on, and I need to wear the mask. However, when they did wear the mask on the street, and they were considered as the people who are sick, they didn't really. I mean, where I heard is like a friends or whatever, they didn't really say that they were like being harassed or anything. They were just saying that people passing by very quickly. And then they, as soon as they saw that, they maybe turn to a different direction right away or something like this. So at times they were like, well, maybe I should not wearing my mask. Otherwise I've been people thinking that I'm sick, which I'm not really sick, or I don't even have fever, I'm not coughing or whatever. And the other thing is what I've been noticing is people have really a good exercise to the media, the massive media. So they heard a lot of stories online and they start to chat among each other. Again, so they people are all aware of what's going on. Yeah, so they are aware and they feel like they have some concern about wearing the mask in the public area. But overall speaking, I think that at least the people around me or all this like employees or family members, they are dealing with that. Yeah.
And in your work with aging populations, are there any specific things you're doing to protect them, or what specifically are you doing?
Yeah, so can you be more specific on your question, like protecting them?
Well, I mean, are you limiting access to outsiders to visit them? Are you providing family with resources or?
Okay. So again, I'm the director of nursing for the SNF side and also the rehab side. So as Kingyang, we have like a assisted living adult family home, and we have healthy living program and home care at the international district. For me, my area, the part of the corporation that I'm working at is located in in Columbia City. So I can share with a bit about like how our SNF side and also rehab side are doing within coping with COVID-19. First and foremost, we limited the number of visitors that come into the building. The second thing we do enhance the cleaning throughout the building. If you can say upside down, inside out. We clean the room very frequently, especially for the most touched area. We clean it if 3-4 times a day, if not every other hour or something like that. And for the residents, if they have the URI or flu-like symptoms, we closely monitoring them. And right now we do have the isolation room ready, just in case. If we observe some like people have a URI, upper respiratory symptoms, we're definitely gonna do the contact and droplet precaution, which was recommended to use nowadays. That's for the residents. Basically vital signs, regular checkup, BID list, and also their whole body and condition, their nutrition, weight loss. That's the area that we're focusing on. In terms of the employee, our employee is also considered as a senior. We have a lot of senior employees with us. So what we do is make sure that they get full vaccination, right? There's no harm for doing that. And the second thing that what we have been doing is emphasize on our facility policy is if you're sick, please stay at home. And for each department, we have a tracking record, and to if you come to work, we have a form saying that you have to take a temperature prior to you start your shift, 1 by 1, temperature check, and all those symptoms check, any cough, fever, shortness of breath, or anything. If you check one of them, we advise them to just stay at home, don't even come to work. And if the employees do have like a flu or cold or being diagnosed, we ask them to stay at home after the symptom is gone for at least 72 hours. And we do have our HR to keep following them, call them, and see how are you doing. And we canceled all the outside performers who used to come in very often. We cancel all that, no group activities, and also we advise the social distance and 6 feet and all that. So but on the other side, we do care about our residents, which is most vulnerable ones, their mental health. So what we did, we have been doing this, we try to have individualized activities. And because again, we limited the number of visitors, that come into the facility, what we try to facilitate the communication between the resident to the family member. We try to use like Skype or Zoom or other ways that we can communicate with them. So that sort of things. And I think we just had a birthday party. Usually we have other family members coming in, but this time we have the party just for the residents and taking photos so we can share later on with the family.
Great, thank you very much.
Sure.
Mariel, could I ask if we've talked about immigrant communities, maybe Asian American communities, and I wondered if there's others like LGBTQ, the Latinx community, African American community, and other marginalized communities, and how they are impacted, and what your experience with.
Well, I think, you know, there's a couple of things that come to mind, and I know that Whitney Keys posted a really nice question, nice in how she termed it, right? With regards to what underserved and immigrant communities can do to protect themselves, but what is it that is their best resource for staying healthy and safe right now? I think that the reality is that for many of our communities of color in our immigrant and refugee communities, and the situation is that depending on where you are in legal status, right, or in what kind of employment you have, that what is a health guidance, right? So if we're asking folks to stay home if they feel sick and they don't have a job that gives them sick time, right? Or if they can't really take it, they'll lose a days of pay. What is it that that we can do from kind of the policy end in order to make sure that regardless of whom, who you are, where you work, et cetera, that you can be able to practice those best practices, right, that we're giving guidance on, and that you don't feel free or the pressure to go against it. Right? And so for many of our communities, that's the reality. And then, the unfortunate consequence oftentimes when there is fear with something that's new, is the hate and stigma that goes out in our communities, right? So, if you ever go down the rabbit hole of comments during like a news story, some of the comments that come out are just, it just really saddens you, right? But as a county, we're really trying to hit home and provide resources to the community that when there is, when there is an action that is taken against you or a family member, your neighbors, that really falls in that line of stigma, then, what are your resources that you have in order to respond to it? Whether it's from the employment front or other areas. And, messaging as well, that's, we developed a toolkit, so then that way, we can have messages out there against hate, because it's really, the idea of the collective, right? That you're, the fear acts very much like a virus, where it's very easy transmissible. What can we do to stop that? And so there's many different fronts in which, I think we're trying to address it. And a very important component is, again, that work with our community members. So, making sure that they're advising us, they're letting us know, hey, this is going on. Okay, what do we need to do to take action? And that's what we've been doing.
How are clinics being impacted, like local clinics, and maybe all of you can address this at the local level? Are they being overwhelmed? Is there enough resources? I know there's the testing kit issue is still being resolved, but can you?
I can address it from a kind of a more macro level, right? And then, if Rana and company wanted to talk about it from the more kind of from their specific organization. I think we've seen it all in the news, hand sanitizer, gloves, face masks. There's different supplies that are needed, right, for the healthcare provider or for the healthcare system that, we're having to, really be thoughtful about who's using what. And so if you hear like a lot of the messaging is, you don't need a mask. You don't need to walk around every day with a mask, right? We need those masks for healthcare providers. Unless, of course, you have a condition like you're immunocompromised and you're going out to your doctor's appointment, then at that point, it's probably recommended by your own healthcare provider to wear a mask. So just being really judicious as a community and being very mindful about these types of supplies. And, between our emergency response center and I know all of the health systems, we're all working in tandem to address kind of these supply chain issues.
Great. Rana, do you have any comments on that? What's happening on the ground at the clinic level?
So this is, I think that our chief operating officer can answer better on this. But what I know is that right now we do have an inventory, and we are observing very closely for the mask and gloves to be used exactly as what CDC is CDC's guideline. And we pass the information along to the patient that they won't need a mask if they are healthy and they don't have any symptoms like cough or fever. And then we triage the patients before coming in. So if they do have a cough or they have a recent travel history, then we ask them to wear a mask before they get to see the doctor. And then we have an isolated room also. So then they can be visited there, and we follow exactly the guidelines of CDC. But what I meant that our patients don't have access is that using sanitizers is really urged by CDC because access to a sanitizer is much easier than getting to a place that you can wash your hands with soap. And I was at a webinar today, and CDC was talking about sanitizer, and especially that they are more friendly on the skin if we are going to use them on a regular basis. So I think that that is a barrier because you cannot buy sanitizer in any of the grocery stores or pharmacies around Seattle, and we need to come up with a solution for our community members to have access. Mm-hmm. I don't know how it's possible, but we really need to think about it. That's a way that can improve everybody's life, and it can make it easier for them that are using public transportation.
Great, thank you. I'd like to, we only have 15 minutes or so left. I'd like to open it up to questions. I see some comments on the comment page, and Nuha, maybe you could unleash people if they want to actually verbally communicate and unmute. So yeah, looks like everyone's been unmuted. And so we can see how this goes. It looks like there are some comments on the side. So why don't we?
The one question that hasn't been answered here was posted by Whitney, and it was directed towards you, Mariel. It says, she said, would you be willing to share some of the negative comments maybe at a high level so that we're more aware of what's being communicated? If we're not in the community, we might not be aware of the negative impact and want to help to stop it.
Mm-hmm. Sure, and that's a really good question. I mean, at a high level, some comments, I mean, I think we all heard comments that were expressed by our president a couple nights ago when he addressed the nation a couple nights ago, and the reference of it being a foreign virus or being a China or Chinese virus. I mean, viruses don't discriminate. They don't know borders. They don't know ethnicity. They don't know religious faith or gender identity. They're viruses. And so, a lot of the messaging that we do, especially, and I just shared the link to our anti-stigma resources, is really that point, right? That viruses do not discriminate. And it's really important that we combat misinformation, because oftentimes what you can see in misinformation as well is this blaming, right, and this hate rhetoric. And so, there's also concern with that has been expressed by different community about, is this a, I guess, beliefs or reactions to individuals who are experiencing homelessness, right? And again, I think it's that question of community mitigation, that as an emergency response, we know that because viruses don't discriminate, what can we do collectively to ensure that we can reduce the risk of the spread of the virus? And with regards to mental health, one of the things that we do know is that even when there's not an outbreak, the availability of therapists, mental health professionals who speak different languages and or are representative of our various cultural communities here, that it's very difficult to find them, right? Many of our mental health professionals are not representative of those groups. And so trying to identify other approaches. For example, we know that there's a group of promotoras who work with puentes, and they've received training on questions of mental health issues, and how can our community health workers, our promotoras, be connected with the Latino community to be able to address depression and or other concerns when individuals may be in isolation, or even if they're not in isolation. This is a very scary time for everybody. So how can we have those conversations, and how can we provide those supports to our communities?
I'm wondering, Janet, would you be able to address that as well, the health, mental health aspects in a policy kind of perspective?
Well, I mean, I agree with what Mariel said. I'm not sure I have much to add. I did want to mention, though, and this is something that, to the extent mental health resources are needed now, the state legislature just yesterday appropriated $200 million for COVID outbreak-related disaster emergency funding. So, and this will go to state agencies, local governments, tribes. And I think that since this has happened, it's really important for people in mental health and behavioral health, as well as in the immigrant community and all the groups that we've talked about who are particularly vulnerable, to make the needs known to the state government, to make sure that the funds, in addition to going toward short supplies and the kinds of relief for healthcare workers that is needed, also are, we think more broadly about the impacts that this disease is having, and how can we mitigate that through additional services.
Mm-hmm. Thank you. Are there any verbal audio comments from participants? Any questions? All right.
Oh.
Go ahead.
I'll just, one other thing I want to get in there is that there's an provision now for unemployment benefits. So a number of people were talking about people who are afraid to stay home from work, but to the extent that people are unable to work, and this I think is going to include some gig economy workers, there is going to be unemployment insurance funding for people. They're going to relax, they're going to do away with the requirement that you have to be actively looking for work, because right now that is really not going to be possible for a lot of people. So just wanted to make sure people were aware of that.
Well, I wanted to ask, because at Seattle City Club, we are all about civic engagement and getting people to get engaged with their communities. And I wondered how all of you would suggest that those of us who are in a position where we can actually help. What can we do if we don't, for example, have COVID-19 and can do some good in the community? What would all of you suggest?
I guess I'll go first. I think there's a number of different ways. So actually, as part of our HMAC response, We have a community-based and faith-based organization partnerships group, work group. And the email address for that is phpartnerships@kingcounty.gov. And so if your organization is not already connected to it, or you as a kind of a community resource are not connected to that group yet, I would highly recommend that you send them an email, and then they can loop you into what they're doing, because this is also a group that brings to light either opportunities or issues that are, that our community is facing right now with COVID. I will type in my contact information on there. So when it comes to an issue or a question of equity, please feel free to reach out to me. Like I mentioned, I am facilitating and coordinating our equity response, where we're really trying to make sure that the considerations, equity considerations, are built into our response. And I think, and thank you, Heidi, for giving us that positive article, because I think we can do with all the positivity that we can at this moment. It's really about the idea of being kind to one another. And if we have older neighbors who maybe don't have family in the area, or aren't or are somewhat socially isolated, check in on them, not necessarily in person, because again, we want to practice social distancing, but calling them on the phone, or, just making sure that they don't need support with, grocery shopping or other things, and just making sure that everyone is, again, as a community, it takes a village, not just to raise a child, but to, basically stay healthy as well, and just to remember to be kind to one another.
Before anyone else jumps in, could you, Mariel, address the question that was just typed up by Jessica? With libraries closing over the next month and emphasis being placed on social distancing, do you know of other safe places where individuals living on the street can use during the day?
Yes. So, I'm not involved with the day-to-day with this particular group, but I do know that we have a homeless services work group within our HMAC response that is working really closely with a lot of providers and with different entities to provide safe spaces for individuals that are experiencing homelessness. And so I'd be more than happy to touch base afterwards to try to connect Jessica if she's wanting to see how she or her organization can assist in that. But that is part of our response.
Okay, thank you. Rana, would you have any suggestions for how people can get involved and help out their fellow community members?
Yeah, so I'm taking a step backward, because also our community health centers all around the nation right now is fighting for their budget under Congress. And I think this is a very good time that it shows how important we are to decrease the risk of coronavirus or other epidemics, and also be the first line to provide services to our community members and raise their awareness and knowledge. So I think that by supporting us to have a solid budget in the Congress, that will save us many things going forward. And I think that will be a very good position that all community-based organizations or all of the nonprofits can help us with.
Julia, any thoughts on how people can help?
I would have that. Yeah, thank you for the opportunity. I would like to say that for the community that I'm serving, there's a lot of needs, and oftentimes I feel like there's a lot of evidence program, for instance, are out there, but sometimes it's so hard to be brought into like the Asian communities or other communities that I'm serving, maybe because of the access to this evidence-based program, it's get blocked, or maybe because the translation of those programs are not being been done, and then it causes some like issues with implementing all those evidence-based program. So the one thing that we would like to seek help is definitely to help us to bring more good, solid, reliable resources or programs to help us, for instance, the mental health issue or feeling isolated or like feeling down or anxious. And so this mental health in general. And the second thing would be, it just, again, I feel like we do have a lot of good resources out there, but I hope that there's a way that can consolidate them all together into a, I don't know how to say that, into a website or something that if you click one button and you can access to all those informations. One experience we have been experiencing since this COVID-19 was we received all those emails from all different smaller community agencies or partners. They're like, oh, register for this webinar and this is all the info and this is all that. There's a lot of repetition and there's a lot of like new things and here and there. So it's more like a scattered all over the place. So if there's a one thing or one initiative can bring all the things together, I feel like that would be more efficient in many ways. And last but not least, anybody in the audience, or feel free to contact with me if you have any questions, or Kian is welcome everybody to come in and to see what are the needs and how they can participate. Yeah.
Great. Thank you. Janet, you have the last word.
Oh, thank you. Well, I'm just going to amplify the messages, disseminate the information you have. Yes, it is scattered, as Julie was saying, but you know, you can provide what information you think would be helpful to people you come into contact with, not too close. And also stay informed. There are going to be critical times for making your voice heard. For example, for funding and so on. I think also if you have ideas of things that needs that aren't being addressed, there is this new pot of money. And so pass along the information. I'd be really interested in any communication around that. We also have a newsletter and we try and keep people posted on those sorts of opportunities. So if you're interested, I'll type our website in here and you can sign up for that.
So in terms of how people could let others know about their interest and who would they contact? Their representative, senator? Do you have any suggestions?
Yeah, well, depending on who's deciding what, I mean, I think it can vary. So legislators at the state level, although our legislature just went out of session, it's for the year. They're always available to contact and might be able to help you to direct you to resources too. At the national level, obviously, members of Congress and senators, and at the local level, maybe Mariel has some ideas about there are of course city and county council members.
Yeah, I mean, I think the system that we have in place with both our Board of Health as well as with our county council and our other electeds, that I mean they're in here, they're working with us to make sure that resources are being provided, that the needs and opportunities are being addressed. So I guess the typical mechanisms that you may have to work with and or communicate with electeds is as important now as it is when we're not within a COVID response. But I think back to the question of if you have ideas and or seeing the needs that of services that the community needs to have made available to them, that's the PH Partnerships group. Please email them. They are working with community partners, faith-based partners to have a coordinated approach and response to making sure that our community is served.
Well, thank you, Mariel. I think we've reached the end of our allotted time. I really appreciate all of you, Mariel, Rana, Julia, Janet, and Nuha for managing the website. We at City Club are trying to do more innovative things as well. So look for our next Civic Cocktail will probably be online and live streamed on April 4th. If you have any participants, if you have any questions, let me know by email, jcarter@seattlecityclub.org. I think I've already reached out to you. And just thank you very much for all of your participation and interest in this topic. So have a great day. Stay safe.
Thank you. Yeah, thank you.
Thank you.
Thanks, everyone.
Bye.